This demonstration of SandlotConnect shows how seamlessly the Health Information Exchange, or HIE, integrates with a patient visit and provides critical information at the time and the place of care. One of my patients, we'll call her Martha, is a 64-year-old woman with cirrhosis of the liver and associated alcohol abuse. She did not follow up in the office for over 2 years before recently arriving in my office with her daughter. Martha presented with evidence of cirrhosis and end-stage liver disease, including mental confusion and fluid retention. Because of her confusion, she could not really provide a reliable history, and her daughter was also unaware of some of her recent medications and her previous treatments. Fortunately, I had SandlotConnect and Martha's Continuity of Care Record, or CCR, which was automatically sent to my office electronic medical record on the day of her appointment. Through the CCR, I immediately learned a number of relevant facts about Martha's recent medical history. During an emergency room visit 7 weeks earlier, she underwent several important diagnostic, laboratory, and X-ray tests. I could also see a number of Martha's diagnoses and problems, some of which placed her at grave risk of serious gastrointestinal bleeding. In addition, she had a urinary tract infection and an abnormal EKG. We can also see that Martha had an abdominal ultrasound 8 months prior to the office visit. Many of these lab results are included in the Continuity of Care record that you're seeing now. For additional information, including the full text of the X-ray reports, I accessed SandlotConnect portal. This physician portal is available through a secure internet site to physicians who do not use an EMR or who are away from their office EMR. Here on the portal, I can also see your diagnoses and the list of medications and a full report of Martha's X-ray studies. Here is the abdominal ultrasound showing evidence of cirrhosis, but no sign of other critical issues. In addition, her head CT scan is normal, revealing no structural reason for her confusion, like a stroke or mass. Now let's go back to my office EMR and the Continuity of Care record. The information from SandlotConnect is a real-time aggregation of my records and those of all the other providers she sees. I'm able to see here that she's taking doxepin. Using a different EMR system, Martha's primary care physician prescribed doxepin to relieve her anxiety associated with her progressive illness. SandlotConnect captured the prescription in Martha's electronic health record and sent it to my EMR. Based on the information from SandlotConnect and knowing that sedative medications like doxepin can worsen confusion associated with liver disease, I concluded that doxepin was likely contributing to her progressive mental confusion, and I discontinued it. I prescribed a different therapy for the confusion. The clinical information available during the office visit prevented the expense of duplicate diagnostic and imaging studies such as abdominal ultrasound and head CT scan. Previous laboratory tests served as useful reference points for tracking the course of Martha's illness. The accurate medication list allowed me to identify a cause for her worsening confusion. SandlotConnect provided a wealth of clinical information at the time and place of service that would not otherwise have been available. Because of the patient's confusion, a physician without SandlotConnect would not have even known that some of the studies had been performed and would likely have repeated them. Without the information provided by SandlotConnect, Martha could have been sent back to the emergency room, or her condition may have worsened to coma and resulted in hospitalization. Instead, we were able to help Martha to promptly improve and avoided hospitalization and the significant expense, both to Martha and her insurance company. SandlotConnect provides the information I need to provide prompt and thorough and cost-effective care decisions for my patients. I'm a better physician with SandlotConnect and would not want to practice medicine without it.